In this video, we are going to see about ECG reading paper and the calibration. This is the paper with reading. We will see certain important things about the paper and how this will be useful for reading the ECG graph. Calibration of the paper as follows. First, we want to remember one thing, that is voltage. The voltage is 10 mm equal to 1 millivolt, that is on vertical axis. Paper speed 25 mm per second, that we want to remember in horizontal axis. In 1 minute 25 mm per second multiply by 60 seconds, so that we are achieved 1500 mm. Therefore 1 mm equal to 0.04 second. This is how the calibration done. Now some important things regarding ECG paper. The ECG paper has surface which is coated with a wax, and it is marked by the small and big squares. Each small squares 1 mm into 1 mm. Every fifth line heavily marked, forming large squares. The recording style automatically gets heated up during recording. This melts the coating of the wax on the paper in that area. Hence, a black line is recorded across the paper. This is how the reading is achieved on the paper. This is one example for how we got that reading and a timing. There are certain things which you have to remember. What is RR interval? What is PR interval? What is QT interval and ST segment? There is a timing, and for more detail, separate video is there for each segment. Go through it. In this slide, you can see the electrodes where they are placing. RA, that is right arm. The right forearm or wrist is the correct place to place the electrode. LA, left forearm or wrist. The left arm is the correct place where we want to place this electrode. LL, left lower leg proximal to ankle. Right leg, right lower leg proximal to ankle. V1, fourth intercostal space, right sternal edge. V2, fourth intercostal space, left sternal edge. V3, midway between V2 and V4. V4, fifth intercostal space with mid-clavicular line. V5, anterior axillary line in straight line with V4. V6, mid-axillary line in straight line with V4 and V5. This is how 12 leads resting ECG electrode placed on the surface of the body. Now we can see Einthoven triangle. Einthoven's triangle is an equilateral triangle formed by joining lead 1, 2 and 3. Einthoven's law. It states that if electrical potential of any two of the three bipolar limb leads are known at any given instant, the third one can be determined mathematically. Thank you.